जय जय राम कृष्ण हरि। जय जय राम कृष्ण हरि। जय जय राम कृष्ण हरि। जय जय राम कृष्ण हरि।
Everybody, I invite on stage revered Swami Dehadeepananda Ji Maharaj, Medical Superintendent, Ramakrishna Mission Charitable Hospital, Mumbai, along with our honorable guest speaker today, Dr. Sunil Saini Ji, Director, Cancer Institute, Sri Raman Hospital, University, Himalayas, Uttarakhand. आज हम एकत्रित हुए हैं एक ऐसे विषय पर आलोचना करने जिसका नाम सुनते ही हमें घबराहट हो जाती है, बहुत चिंतित और वेदना पैदा हो जाती है, कैंसर। इसी के बारे में हमें मार्गदर्शन करेंगे डॉक्टर सुनील सैनी जी। उसके पहले मैं पूज्य स्वामी दयादीपानंद जी महाराज को निवेदन करूंगा कि वे कृपया सुनील सैनी जी का स्वागत करें और हम सबको उनके बारे में 2 शब्द बताएं। पूज्य स्वामी दयादीपानंद जी महाराज।
ओम नमः श्री यतिराजाय विवेकानंद सूरये सच्चित सुख स्वरूपाय स्वामिने तापहारिणे। Our devotees, staff and the distinguished guests present who are with us in this auditorium, and also a lot of viewers on our Ramakrishna Mission YouTube channel who are eagerly watching this program live. This is the special series of lectures which we have been conducting for the last 2 months. We plan to have bi-monthly series of lectures. Last time we had Dr. Rajiv Singh, who spoke on diabetic foot complications, how to take care of the foot, and a lot of people got interest and they came to do a follow-up with me. What is the holistic approach to diabetic foot care? We have a testimonial who is sitting right in front, Manu Chabriaji, 80-year-old gentleman who was suffering with type 2 diabetes for almost 20 years, and he met the best diabetologist in Mumbai. Unfortunately, he was not having the results what he was looking for, and complications were setting in. After the talk of Rajiv Singh, he had many queries, then he came to my office. Then we helped with integrated approach to reverse disease. As I keep on telling, holistic approach is the future. Lifestyle modification is the future. Nowadays, the top researchers at various universities, national and international universities, they are working mainly on how to have a holistic approach through lifestyle modification. How can we reverse the diseases, at the same time prevent? So with this background, when I talk to Dr. Sunil Saini ji, who is here with us, about whom I will be telling now. He is a renowned cancer surgeon, presently working at Swami Rama Health University in Dehradun. It's one of the best top medical college in Uttarakhand state, and as you know, I had the opportunity to serve in a Ramakrishna Mission Hospital in Haridwar So during that time, we had a lot of acquaintances with all eminent people. So he's one among those eminent people in the state of Uttarakhand. He has done his cancer studies right from Banaras Hindu University, then here in Mumbai, and presently he's working at the Swami Rama Medical College. And he also had special training outside India, like Sloan Kettering Cancer Institute in New York. Since 1992, he has been serving this prestigious hospital as an oncosurgeon, and presently he is the director of the Cancer Institute at Swami Rama Health University in Dehradun. There is a lot of things which I keep on reading about him. His main focus is preventing cancer, creating awareness in the society, and also is a very active surgeon who leads a big team. Annual Cancer Institute serves more than 4,000 new cancer patients. They have more than 260 beds for the cancer specialty in the university. And so much to his achievements. He also advises the state government on healthcare to prevent, manage cancers. His vision and services as a clinician, researcher, and leader in developing cancer healthcare infrastructure have significantly impacted the lives of many people in the region. So I will not go to further credentials because it will take a lot of time. Yesterday he came, met me, spent some time together. Today he has some official work in Mumbai. He finished, and I said, why don't we use his precious time with us, with our doctors, nurses, and our well-wishers who are interested in knowing all about health. So before I invite Dr. Sunil Saini for his talk, let me share a few things. As I said, holistic wellness center, integrated medical center in future is the future. तो एक तो बीमारी आ गया, बीमारी को क्यूर करना है, राइट डायग्नोसिस करना है. So all should work as a team. Everybody should speak the same language. Right from the director of the Cancer Institute to the junior doctor, the paramedical staff, and the social health workers. All together can give a holistic approach, including diet, exercise, counseling. So this is what we are developing. And I saw him in Swami Rama Health University in Dehradun, and he has that concern, his concern to patients. And he has been leading many teams in different places. He is also the ethical committee chairman at AIMS Rishikesh, which we meet often, once in 2 months, online Zoom meeting. So he is the best person to make the subject very easy. As Ratan Chaudhary was introducing, he himself is a holistic wellness practitioner. He has reversed his diabetes, and so how he volunteers to organize such medical seminars here. And we are looking forward to listen from Sunil Saini to listen about such a dreaded disease. कैंसर का नाम सुनते ही सभी को मन में भय आता है. So knowledge is power. That knowledge which helps to prevent the dreaded disease and also at the same time to provide the right treatment with right preventive methods. So he has all these things in his mind. He will be addressing doctors, nurses, along with the common man who is interested to know about the disease and its prevention. So we have given the topic as Everybody Know Your Body. On our YouTube playlist we can see. So this is the second series of lecture that we are going to have today. So in this series we will listen to Dr. Sunil Saini now on the holistic approach for the comprehensive management of cancer. So I hope it will be very interesting. He will make the topic at the same time simple. We were a little late in starting the program for various reasons. So I will request him to take his own time, maybe 30-40 minutes he'll speak, then he can take some 10-20 minutes question answer. So up to 3:50 we have time. So now the mic is over to Dr. Sunil Saini. I also request all our audience to listen properly and have any questions, note down and feel free to have our questions answered. So I'm very happy on behalf of all our staff, our health lovers and Ramakrishna Mission monks. I extend him a cordial welcome to our Ramakrishna Mission. And this brief introduction, now I call upon Dr. Sunil Saini, please.
आप सब लोगों में निहित परमात्मा को मैं नमन करता हूँ. And I would like to say I really feel humbled by the gesture of revered Swamiji for his invitation to come here, to be with him. अपने सानिध्य में रहने के लिए उन्होंने मुझे मौका दिया. I was coming to Mumbai for my personal work, official work, some important official come personal work. And I talked to him and he suggested, why don't you stay with us? And it was really very, I would say very pleasing and very great moment for me to hear that I could stay here at this place. I took it as a pilgrimage. So I'm really, since yesterday, I'm feeling as if I'm really blessed being here with all of you on this campus. And thank you. He told you so many things about me. Let me share with you. Whatever I was able to do over there was not to receive some admiration or acknowledgement. It's just like I've been trying to follow the footpath of Swamiji, trying to serve the people in foothills of Himalayas. I've been here in Mumbai in 1990-91, trained at Chatamal Hospital, Mumbai. My teacher was Dr. Ashok Mehta, where I learned about head and neck cancer surgery. And from here, I went back and to serve in foothills of Himalayas because that was close to my place, my home. And I was told a Swami is building a hospital there. Although that was a forested area, but still, since it was a Swami who was saying, I believed him. And I committed myself to work over there. So since then, I've been working at that place, and now it has bloomed into a big campus, a university campus, including a hospital. And in this process, I had opportunity to contribute to develop some of the facilities, and no doubt to serve and have the pleasure of serving thousands of patients. So I see that as like I gained out of it, serving them. Well, okay. Well, although most of you might know, just I brought this map. Uttarakhand is located close to China border and Nepal border. And we are located in Dehradun district. And Swamiji hospital was also close by Haridwar. And Haridwar, Rishikesh and Dehradun. I'm close to the airport. It's midway between Haridwar, Dehradun and Rishikesh. So this is the place I happened to meet Swamiji at AIIMS Rishikesh, where we used to have together ethics committee for the biomedical research. So there I got to know about him, and naturally it was quite natural that I got attracted, influenced and impressed by him. Well, this is my hospital, including my campus. You can see And we are a medical school. We have a big hospital, 1,300 bedded hospital, a cancer institute, and a rural development institute, and many other faculties of many other schools. Now it is a university. And why I'm sharing about this place, that just like Swamiji is trying to integrate holistic medicine into healthcare, more so for prevention of dreaded diseases, including cancer and diabetes. So my place also was founded by a saint with the same intent, where he was trying to bring in the technology from the West and integrate it with the Eastern philosophy. So he was trying to bring East and West together. And we truly have been trying to do that. In my hospital over there, you can see lots of focus on yoga, lifestyle, stress management. All the faculty and students are oriented once they join us. Just like this place, we also start our work with prayers every day in the morning. And you can see, if you walk through the hospital, nurses trying to take patients through yoga and stress management as well, in addition to their routine care. So today's topic, let me come to today's topic about cancer. As I heard Swamiji and Chaudharyji also about cancer is a dreaded disease, well, I would say not anymore. This is what I would like to tell everybody. Although, like when we hear in being in society that so-and-so got cancer or so-and-so family got affected by cancer, we feel bad about it, scared about it. And we feel everybody around is having cancer and suffering from cancer. To some extent, true, but there are good reasons for that. There are bad and good reasons both. So I would like to dispel this myth about cancer everywhere. Well, as the time is passing by, our average age is improving. Now it's about 70 and 67 for male and female. When we became independent, we were just, our average age was 37 years. So cancer usually comes as we grow. So it affects elderly people or as we go through the life. And plus, you can see our population, which was 37 crore when we became independent, is now almost 140 plus crore. So the population density has gone up. Then another thing, lots of chronic diseases, which used to be there earlier, now, infectious diseases and infant mortality, they were high and infections were common. People were used to die of malnutrition. They used to die of malaria and tuberculosis. Now, nobody dies of those illnesses. I mean, very few would die. So now, because of this, the infectious diseases have come down and non-infectious diseases or chronic diseases have become prevalent. So that's how we see more of diabetes, we see more of heart disease and cancer. Then another important element, earlier, most of the people, those who used to get cancer, they used to die soon, within 6 months or a year. But now everybody has a chance to live for much longer. A large number of people, they get cured from cancer forever. But still they are labeled as cancer patients. So, and many others would survive for 5 years, 10 years. So that way, the prevalence of cancer is more. So you see a lot of people surviving with cancer. So that's how you find so many people with cancer. So this, I'm trying to tell you, there's no need to feel fearful about it. We just need to be aware and we need to get the right treatment at the right time, at the right place. As of now, we in our country, almost 15 lakh cancer patients are seen. New cancer are expected to be there every year. So this number is increasing somehow. There is a definite increase also in cancer because of lifestyle changes, including our diet, adulteration, pollution, and all these things, a lack of exercise. So this is adding to the cancer incidence as well. But at the same time, there are good aspects of getting control over it and understanding it. As all of you might know, usual treatments are like surgery, chemotherapy, radiation therapy, right? I'm sure all of you have heard about it. And some new drugs like immunotherapy, targeted therapy, these are the common treatment. Well, you all are aware about it. But what I want to highlight today for you, that in addition to these are known as specific therapies or cancer-directed therapies. But to treat cancer, we need many other kind of therapies also, where you have a much bigger role compared to an oncologist. So there's a role for nurses, for dietitians, for family members, for physiotherapists, for yoga therapists, for complementary therapies. Everybody has a big role to play. It's not only a cancer doctor. And effort of all these people makes a huge difference, not only in giving good quality of life, but even to have survival benefit. So I'm not going to talk about what these therapies are, but to tell you that these therapies are really very toxic. But still we have to do it because these are the specific treatment. Say chemotherapy and radiation, there are lots of side effects. And surgery, no doubt, we chop off the body parts, right? So not only they have physical, but they have lots of social, emotional, and financial impact on individuals. So that way, they are really very toxic. So we have to, if at all we have to have it, we have to have them in a way so that the effects are minimized. Or to minimize the effects, they are combined together. Or they are given in a manner, one after another, so that the impact is minimal. So here, understanding that there are so many side effects, there is a need of comprehensive care. Comprehensive care, which these therapies, which I'm talking, say surgery, chemo, radiation, they work largely at our physical being. They don't work at our emotional being or our subtle body, being of our subtle part of our being, right? And so they largely look after the physical aspect, not the mental, not the social, not the spiritual dimension. Rather, they knock down most of them. But still, we have no choice except to have them. So there is a need to address emotional, social needs and to maintain quality of life. So how we do that? We need to have rather a disease-directed approach. We need to have a patient-directed approach, where every patient is different, and not from the point of view of disease, but looking in totality from their social perspective, their family perspective. We need to see them in totality to make a decision about them. And this decision has to be a collective decision, a shared decision making. In other way, I would say these therapies, which I do day in and out, they are very violent in nature. Because cancer surgery is violent, chemo is violent. It's just, we treat cancer just like we are dealing with a terrorist. We try to kill a terrorist, or we have a warfare somewhere, right? So radiation is just like a warfare. We just bombarding with radiation. Chemo is like warfare. So when there is warfare, there are a lot of collateral damage also. So there are lots of side effects. So that means we have to change the way we work with people, and we have to bring in more humble, more gentle therapies to along with them. So I was talking about shared decision making. So most of there's another form of violence. The other form of violence is the doctors don't share enough with their patients. They push their agenda. They will make their patients to accept what they're suggesting. So this is also a form of violence. So we have to make a collective decision, sharing with the patient, well, this is the benefit which you might get out of these therapies. So this is, so effective communication, empathy. So I would say these are the elements which needs to be integrated. And accountability, being honest with your patient and families. So these aspects have to come. So in cancer care, to mitigate like one individual, what we try that if we leave the patient management in the hands of one individual, he may end up applying all his therapies. So there is a practice of collective decision making. We call it multidisciplinary team effort or decision making. So where all the disciplines are there, so they make a collective decision. What's going to work for this patient? Or we sometimes call it a tumor board as well. So in this tumor board, no doubt there are technical people like surgeon, chemotherapy, doctor, radiation. But what is the need? There has to be other people also, including a spiritual counselor. They are needed. At my place, we try to do that. In many patients, they are not treated in a big hospital, so such team may be lacking over there. But I would say in such a scenario, a doctor has the responsibility to include his friend circle doctors within the town and make a collective decision. So in this reference, I'm trying to say that apart from these cancer-directed therapies, there is a need of supportive therapies, and including for pain management, for nutritional support, and for rehabilitation. So when I say holistic means it's not only a doctor-driven treatment. It has to be delivered by many other people, nurses and allied healthcare workers. So we have to bring in everybody, give them due respect, due place in helping a patient. Quite often, there's a lot of focus on recruiting a good doctor or hiring a good doctor, giving him enough opportunities, but services of nurses and allied healthcare workers are neglected. They may remain understaffed or they may remain overburdened. So that's how these elements of healthcare they suffer. So this is one aspect, like all cancer patients, once they are diagnosed having cancer, they go through lots of psychological distress. They go through distress not only because of disease, but because of coping up with the new realities in their life. And these realities, they bring lots of other issues like their livelihood, their leadership within the family, or their status in the society, their identity in the society. So they are affected on many dimensions. So helping these patients to cope up well is very important. So here is a role for all kind of complementary therapies, including yoga, lifestyle, understanding philosophy of life, and counseling, and like that. And it's not only about the patient, it has to extend to everybody around them, to the family and the caregivers in the family. So counseling, often you might have seen a doctor has very little time, hardly 10 seconds, 30 seconds, 1 minute, and in busy clinics, they don't give enough time. On the other hand, these patients need so much of time, they need attention. They are wanting to hear a doctor. So here we have a lot more people have to pitch in to support them. So I'm trying to highlight, well, there is a role for everyone, okay? Including the attendants sitting outside the clinic. They can play their role, not just doctors. And well, there can be a support group of doctors, a support group of patients, those who survived or they're going through treatment. They can help each other. Well, here I'm sharing some of the studies which we did at my institute. Since it's a medical school, so research and clinical services, education do go hand in hand. So some of my students, they did these studies on patients coming for in the OPD and they did a survey and found up to 40% of the patients, those who were sitting in clinic, they were distressful to extreme stage. So that means a doctor has so many patients sitting outside who are really distressful for multiple accounts. So we need to do something. And to help them is to acknowledge their distress. So first we acknowledge, and then only we can intervene. So this may vary depending on this kind of geographical area we are catering or the social class we are catering, but distress is very common. So what we did, let me share with you. Yeah, with the help of a doctor who is known as Dr. Rajgopalachari. He is from Trivandrum, and he is known as father of palliative care in India. We started a program in our hospital. We call it a pain-free hospital initiative. So what we do, like every patient who comes, we score their distress and pain. And a doctor sitting in the OPD or in the ward, they will get to know this patient is distressful. So then we do targeted interventions to help them out. So first thing is to acknowledge the distress. So that's what. So these things are common in many cancer centers. So we also try to implement that. Like this in ICU, in the ward also, a nurse would daily would record the score of a patient. So as you go for a round, you will know how much pain he has today, how much he had yesterday. Another important element, we all remain focused only on patient, thinking he has pain or he is suffering, let us give him this medicine, that medicine. But we forget those who are taking care of these patients, they also become distressful. And we did this study and we found there was lots of distress among the caregiver. So even the caregiver in the family, it may be a spouse, it may be parents, it may be anybody in the family, because cancer treatment goes on for many months or years together, and it's draining on part of resources, financial resources. It's draining on part of, like, people end up giving their jobs, they can't go to work. Even a caregiver can't go to work, so the whole family is into distress. So we need to acknowledge this. And quite often you might find patients are getting jittery, they are shouting, they are struggling, they are fighting. But as a healthcare provider, we have to bear with them. If we understand that, well, these patients are the ones who are suffering all the time within, the family also suffering, our reaction would be different to them. We would like to still welcome them in spite of their whatever they do. So it's important to understand the psychological journey of patient and families as they go through the cancer treatment. So how a yoga can help? Well, here I would like to say, we keep talking about, everybody keeps talking about instituting yoga or say any kind of therapy, holistic therapy or complementary therapies for the patient. I like to tell my colleagues, my residents, first thing, a doctor himself has to do it. First, a doctor has to learn to be at peace with himself. If you go to a clinic where a doctor is not at peace, he's busy with his phone, or he's not in his good form, he's shouting, he's struggling, he's not communicating enough. So such a doctor is good for nothing. So he can't really help his patients well. He can't really take them through, or he can't be a holistic doctor. So I want to say holistic therapy means first you have to be a holistic doctor. We have to practice ourselves first, restrain. We have to learn to restrain. We have to learn to communicate effectively, lovingly, okay, and with empathy, with the intent to help individuals. If we have business in mind, then actually we can't institute any kind of therapy. if the business is nagging us. So my focus is helping my colleagues to be at peace with themselves. So this is also one of the agenda when we talk about it. Okay, so well, in our study we found, a lot of time patients, they are dumped into intensive care units when they are dying, or they are put into hospital. But if you really talk to them, if you communicate enough with them, they may like to stay at home. They may say, let's go back and let's be within our family, so that we can die, or so-and-so can die with peace. So it's more about communication, more about sharing honestly. Another aspect is nutrition. Nutrition is an important element of our philosophy, Indian philosophy, yoga, Ayurveda. And in cancer care also, nutrition is playing a big role in cancer causation. It's because of the kind of nutrition we have, which is not holistic. But when someone got cancer, things are different. That is not the time of prevention, but that is the time of sustenance of body, or having enough energy and nutrition to fight out with the disease and to mitigate the side effects of therapies. So that is the time patients need good nutrition. That is not the time of parhej, that is the time of eating well. So that's what I would like to say. We need to differentiate, and we found out in our country, I would like to share a pity for us. As per our Indian NABH, National Accreditation Board for Hospitals, as per their directions, there is a need of only 2 dietitians over a 500-bedded hospital. So how they can cope up with so many patients, giving them good counseling about diet? So there's little focus on diet. And every patient in India, he asks, usko kya khana hai, kya nahi khana hai. Their focus is, ki aap parhej bataiye, kya karna hai. So we have very little time to explain them. When there's so much of focus on diet, we need to have more dietitians in the hospitals. So I would say that's a holistic care, bringing everybody, all stakeholders into picture. One of my students did PhD under me on oral health. Oral cancer is very common. In addition to this, all patients, those who receive chemotherapy or some kind of therapy, their oral hygiene, their oral health is impacted. So large number of cancer patients, they need oral care. And we have very few dental doctors in any hospital. Many cancer hospitals, they don't have a dental service. So that means we are lacking on these accounts to give good oral care. So that's another thing we can institute to bring holistic care. So he brought some protocol as well, my student. Nursing professionals, I believe they are the backbone of any hospital. 80% of the time is a nurse who spends with the patient, not a doctor. So we need to elevate their level, their self-respect, their respect for the work they do, and have more number of the nurses. We need to have, Swamiji was telling, to have more nurse practitioners in different areas. Same way, allied healthcare workers, including dietitians, physios, and maybe paramedics, and counselor, clinical psychologist. Physical therapy, most of the patients after getting treated for cancer, they need to go back to their work. So there's a need of rehab doctors and facilities. Well, all this is well established. All kind of these therapies, massage, yoga, and meditation, they are helpful. They are helpful. Well, we can see in 2 ways, 2 aspects, whether they can prevent cancer, I would say yes. Whether they can help in recovery from cancer, I would say yes. How they can help us in preventing cancer? Because cancer is a lifestyle disease. if someone is disciplined in his mind, in his thoughts and his actions, naturally he won't indulge in things which are cancer causing. So one has to adopt a lifestyle which is balanced. So our Indian philosophy of yoga, of meditation, including Ayurveda, all these are preventive, promotive. So we need to, and there are lots of clinical trials, studies to validate about these concepts. So there's a need to take it forward and let everybody know about it and adopt it. One of my students again did PhD on yoga therapy. Patients receiving chemotherapy, they were given yoga, stress management and gentle yoga, and we found they were having less side effects. So she did a study in 150 patients, a randomized clinical trial. Ayurveda, yes, my state is known as a herbal state. Ayurveda is something which we can use in multiple places. One of my students did a study on using mullahti for radiation-related side effects. But more than this, I would say nowadays we're talking about nutraceuticals. Nutraceuticals are Ayurvedic product, and they are good in many different ways in different diseases. So we in India must promote them. Okay, I'll just spirituality and cancer. Well, those who believe in it, it's helpful for them. It's helpful in coping up with the disease, coping up with the new realities in life, coping up, bringing the family together, resources together, and fighting it together, and going back to work. People, those who have such kind of convictions of spirituality and divinity, naturally they cope up better. So without infringing upon individuals' faith, one can promote it, understanding they believe in it. Okay, just another thing is, you all heard about aggressive chemotherapies, but sometimes very gentle chemotherapies, very little dose of same drugs can be given for treating cancer. As you know, many of our herbs and what we say, everything available in our kitchen, vegetarian diet prevents cancer. At a very small, subtle level, it keeps working within the body to keep tendency to get cancer in a check. So same thing, many cancer drugs which otherwise are used for treating cancer, if they are given in a very small dose, they also work. We call it metronomic chemotherapy. We use these drugs for palliative care. Just quickly, I would like to, time is over, I know, Swamiji. Just quickly, the facilities and how we lay out our hospital and the facility, that also makes a difference. You are in a very busy town here, but still I can see so much of organization of the work. Same thing has to happen everywhere. We forget about it. When a patient comes, or we go as a patient in a hospital, if we find people are helpful, the corridors are not crowded, we can easily walk through, there are signages, it's easy to find places, it's easy to ask a question and get an answer. It gives a sense of feeling good. All that is desirable in the recovery of a patient through the journey of their illness. So it's important to focus. So what I mean to say, hospital management plays a very big role in the recovery of individual. So this is about spatial experiences, like how the building is structured. Sorry, yes. Okay, so we should focus on making the building look good. It shouldn't look like an industry or an industry where lots of conduits and lots of threatening things are there. Financial toxicities. Well, this is a major issue in our country. However, thanks to Modi ji and his initiative of Ayushman and many other schemes, so and philanthropy, like which I see here, lots of this hospital is run through philanthropy and donors. So it's helping a lot, right? Because cancer is such which not only would kill patient but would kill the family. I would keep pulling up my resident doctors when they write expensive medicine that you don't understand. There might be a little child in the home whose education would suffer, whose career would suffer if you make them to spend unnecessarily. Just because you know a name of the medicine, that does not mean you have to write it. You need to be mindful. All right, just one aspect, that's cancer survivorship. This is important issue, and Swamiji, I want to bring to your attention as well. You know, as the technology is evolving, we have a lot more patients who are surviving after getting treated with cancer. They got cured of cancer, or they may still have cancer, but they have still long life to go. So we call it cancer survivors. So they have their own issues. They have to go back to society, or they may have many side effects related to the treatment or some disabilities. There's a huge chunk of these patients. So far we have only focused on treatment. But now we have a big lot who are surviving. So we have to enable them, these individuals, to be part of society again and to live a good quality of life. So now the focus is shifting, it's being acknowledged, and we have to address it. Fatigue, another thing, where Swamiji, your therapy may work. 50% of cancer patients, as they go through treatment, they experience varying degree of fatigue, कि उनको थकावट महसूस हो रही है. कोई कारण नजर नहीं आ रहा है, लेकिन थकावट है, थके हुए महसूस हो रहे हैं, उनकी क्वालिटी काम नहीं कर पा रहे हैं, वो they are not feeling good. And this is because of cytokines, pro-inflammatory cytokines. So here, yoga therapy can work. So you can focus on fatigue during the cancer treatment. 30% of patients, those who are survivors, they also have fatigue. Many patients, they gain weight. Many would lose weight. So we have to maintain a balanced weight. So these are another aspects of cancer care where we can. So it's not only that we prevent cancer or treat cancer. There are so many aspects around cancer care where there is a scope of integrating our traditional knowledge, our rich heritage to bring solace to our patients. Okay. All right. So this is what research, no doubt, it has to go side by side, including research into complementary therapies. I would stop here. Okay. Well, this is, he's the founder of my organization, Swami Rama. Okay, sir. So thank you.
After that very informative and encouraging talk by Dr. Sunil Saini ji, any questions to be asked, please raise your hand. So I think I have one question. Okay, please go ahead. Yeah, he'll give you the mic.
नमस्कार. मैं नमस्कार, मैं डॉक्टर गणेश अरुण जोशी रिहैब मेडिसिन स्पेशलिस्ट हूँ और मुझे एक क्वेश्चन था कि जनरल फिजिशियंस दे आर नॉट अवेयर ऑफ केयर ऑफ कैंसर सर्वाइवर्स and they are sometimes afraid of what drugs are not allowed, what drugs are allowed to be given for treatment of general conditions like some antibiotics or some antihypertensive drugs, anti-diabetics. So is there any such difference in treating cancer survivor as compared to a general population, or the drug prescription is same?
Okay, thank you, Dr. Joshi. Yes, this is a very commonly asked question by patients, whether they can take treatment from their local doctor or not. I would say yes, always they should go back to their local doctor. This is one. And he must be the rather key person taking care of them once they have completed their cancer treatment in any cancer institution or with a cancer doctor. Whether they can be given treated for other illnesses, yes, because it's not only cancer. A human being can get affected by any illness, right? So unless they are receiving some kind of therapy already, some kind of chemo, during the chemotherapy, during the active treatment, naturally there is a need to interact and find out what is being done. But once the treatment is over, then there is no barrier, and a local physician should be able to take care. Rather, we need to encourage them because many of the physicians are hesitant, and they, for a simple thing, they would send patient back to a cancer center, which is not appropriate. So every doctor must have that much of skill, knowledge, understanding, or there has to be a way of communication between the two, treating cancer doctor. Rather, Dr. Joshi, you must make some comments about rehab, you being an expert, so you are expected to.
Good evening, doctor. Cancer is actually traced at a very later stage. Mostly it is found. So are there any signs and symptoms to trace at an initial stages?
Okay, very good question. First, let me share with you, it is not always true. It depends on the kind of cancer. There are certain cancer which can be diagnosed early, and they are being diagnosed early. Like, say, breast cancer. It can be diagnosed in very early stage. Say, uterine cervical cancer, oral cancer, okay, skin cancer. So they can be diagnosed in early stage. And things are changing. 30 years back, when I started my career as a cancer doctor, almost everybody was coming in advanced stage, 70 to 80%. Now in my hospital, where I practice, up to 40 to 50% patients, they come in early stage. And how this has happened? It has happened through socio-economic development, more awareness, more healthcare services, more qualified doctors available. So things are not that grim anymore. Another aspect is there are certain cancers which are still diagnosed in advanced stage, such as lung cancer, cancer of the food pipe, cancer of gallbladder, cancer of stomach, cancer of pancreas. So they are, and cancer of ovary. It's because it's difficult to diagnose them in spite of having technology. Even in advanced countries or developed countries, they are diagnosed in advanced stage. So one has to be vigilant, aware about the signs, symptoms, and visit a doctor soon. Thank you.
Hari Om, doctor.
Good evening, sir.
Doctor, I have undergone a surgery for cancer.
Okay, sir.
My large intestine has been removed, big portion of it. Is it a possible that I can again get recurrence of the same?
All right, sir. Please sit down. Although it depends on the stage also to some extent, right? At what stage your cancer was diagnosed, and although to some extent, still there is chance of disease coming back, but our focus is to diagnose that early. So in such anybody who gets a cancer, we keep calling them for regular checkup, regular follow-up. Like in your case, maybe a regular colonoscopy is desirable yearly, and then imaging, which could be a CT scan or sometime a tumor marker, which is known as some tumor markers specific to colon cancer. So these are done frequently, and as the time passes by, the chances of disease coming back comes down. Like say initial 1 year, we follow up them for every 3 months, initial 1 or 2 years, every 3 months, thereafter every 6 months, then every year, like that, right?
3 years are passed.
Okay, so your chances of disease coming back are going down with time. Okay, it's a good sign that 3 years you are disease free, which is very good. And although to say specifically for you, I need to look into the more details about your disease and treatment. Okay.
Any general questions? Yeah.
Good afternoon, sir. Sir, because this is integrated, I just wanted to know, as you mentioned food and you mentioned mulethi. So I wanted to know, is there anything that we can, like other than tulsi, I'm aware that jo tulsi milti hai mandir mein, that has anti-cancerous properties. Anything else that we can as a society include in our diet, everyday diet, that could bring down our chances because of the pollution and all that we are getting?
Okay, very good question. Okay, well, as per there are Indian guidelines also, but I would quote American Cancer Society. The American Cancer Society, it says on its website that taking vegetarian diet, a balanced diet, prevents cancer. And what kind of diet? Anything, everything which is available in Indian kitchen, that prevents cancer. In Indian kitchen, we eat lots of green vegetables, we eat legumes, we take lots of masalas, right? They all are helpful. They all have antioxidant property. But what is desirable? That we do not overcook them. This is one, right? And we do not. We must consume energy in a balanced manner. Taking too much of energy or calories also is not good, right? So I would say in one word, just stick to Indian food, vegetarian food in a balanced manner, right? And not to stick to any specific vegetable or specific. It's better to keep changing, have a variety in everything. But fresh fruits, vegetables, legumes, and all masalas, okay, are good. And although Swamiji has more experience about it, he will share with you. Okay. Okay. Yes, please.
Good evening, doctor. I want to know that if there is somebody in the family who's had cancer, is it by DNA test, can you know at a stage, earlier stage, that if anyone can get it?
Okay, all right, very good. Please sit down. All the kind of cancers which we see, only 10% of cancer we can be attributed, or we can say केवल 10% कैंसर को ही हम कह सकते हैं कि वो जेनेटिक हैं. अदरवाइज ज़्यादातर कैंसर जो है वो हमारे लाइफस्टाइल से संबंधित हैं, या फिर हम इस दुनिया में कहाँ रहते हैं, कैसी लाइफस्टाइल अडॉप्ट करते हैं, क्या चेंजेस हम अपने चारों तरफ डेवलप करते हैं, ये सब चीज़ों से डिटरमिन होता है हमारे कैंसर होने का चांस. लेकिन फिर भी 10% कैंसर जो है वो अनुवंशिक हो सकते हैं। तो कौन से ऐसे कैंसर हैं, जैसे ब्रेस्ट कैंसर है, हर तरह का ब्रेस्ट कैंसर नहीं, उसमें भी बहुत स्पेसिफिक ब्रेस्ट कैंसर है, ट्रिपल नेगेटिव ब्रेस्ट कैंसर है, या फिर किसी की फैमिली हिस्ट्री है, तो उनमें हम जेनेटिक टेस्ट करके ये देख सकते हैं कि फैमिली मेंबर्स को कितना रिस्क है। ठीक है, तो ऐसे ही कुछ और भी तरह के कैंसर हैं जहाँ पे हम रिस्क के बारे में एसेस कर सकते हैं, उनको वार्न कर सकते हैं पहले। तो ऐसे रोगी का फिर रूटीन चेकअप और फ्रिक्वेंटली किया जा सकता है। कभी कभी हम लोग जो है जैसे ब्रेस्ट कैंसर में यदि किसी को एक जीन होता है, उसको BRCA जीन कहते हैं, BRCA 1 और 2 म्यूटेशंस देखते हैं। यदि वो पॉजिटिव हैं तो कुछ लोगों का मैस्टेक्टमी भी कर देते हैं, प्रोफिलैक्टिक कर देते हैं, पहले से ही कर देते हैं, लेकिन ऐसे रोगी कम होते हैं। तो इस बारे में मैं कहना चाहूँगा कि इस बात की जानकारी होना बहुत ज़रूरी है, लेकिन उस जानकारी को पाकर या उसके बारे में सोचकर अपने जीवन को दूभर करना उचित नहीं है, उससे डरना उतना उचित नहीं है। क्योंकि कुछ रोगी मैंने देखे हैं कि वो अपने बच्चों के लिए डरने लगते हैं, अब आगे की फैमिलीज के लिए डरने लगते हैं, वो उचित नहीं है। ठीक है, टेस्ट करा लेना चाहिए, यदि पॉजिटिव आता है तो फिर उसके बारे में एप्रोप्रिएट काउंसलिंग की जरूरत होती है।
Anybody
Yes.
else? Oh,
Yes,
Malini.
please. हाँ, ओके। देखिए, आयुर्वेदा के दो पहलू हैं, एक तो ट्रीटमेंट का पहलू है और एक है जो कि डिसिप्लिन का है। तो डिसिप्लिन तो शुरू से ही करना चाहिए, जब भी समझ आ जाए जीवन में। ठीक है, जो ट्रीटमेंट वाला पार्ट है, जो दवाई वाला पार्ट है, वो हमारे जो कुछ लोगों ने क्वेश्चन पूछा है क्या खाना चाहिए, या वो भी एक आयुर्वेद का ही पार्ट है। उसकी जानकारी हमें होनी चाहिए कि हम अपना खान पान को जो है होलिस्टिक रखें, वो शुरू से ही रखें। मेडिसिन पार्ट जो है, देखो मैं आयुर्वेद का एक्सपर्ट तो नहीं हूँ, लेकिन दोनों पहलू मैं आपको बताना चाहूँगा। उसका एक नेगेटिव पार्ट भी है और एक पॉजिटिव भी है। पॉजिटिव तो ये है कि बहुत सारी कैंसर की दवाइयाँ भी आयुर्वेदिक दवाइयों से निकली है, एक तो ये बात। फिर लेकिन जो आयुर्वेद की दवाइयाँ हैं उनको हम एक सपोर्टिव ट्रीटमेंट के रूप में तो ले सकते हैं, ताकत के लिए, इम्यूनिटी के लिए, रिक्यूपरेशन के लिए, इसके लिए तो ले सकते हैं। लेकिन यदि हम ये कह के ले रहे हैं कि इससे हमारा कैंसर ठीक हो जाएगा, ऐसा कहना अपने आप को भ्रमित करना है, वो उचित नहीं है। ठीक है, दूसरा एक पहलू मैं बताना चाहूँगा कि अक्सर लोग कहते हैं कि आयुर्वेदिक दवाई का कोई साइड इफेक्ट नहीं होता है। ऐसा कहना उचित नहीं है। बहुत सारी आयुर्वेदिक दवाइयों का भी साइड इफेक्ट होता है, और चूँकि हम एज ए डॉक्टर देखते हैं उनसे बहुत सारे लोग भस्म देते हैं। कई बार आयुर्वेदिक के डॉक्टर पूरी बात सही से बताते भी नहीं हैं और उनके साइड इफेक्ट हो जाते हैं। तो हमें सजग रहना चाहिए जो भी करते हैं, और बिल्कुल अंधभक्त होकर नहीं करना है वो काम। ठीक है,
Thank you very much, everybody. I would now request Revered Swami Devananda Ji Maharaj to please summarize today's program.
At the outset, I feel it was a very successful lecture on a topic which is very complex, and to address to group of audience where you have doctors, nurses, and our devotees and health learners. So only a man with experience, knowledge with experience, which call as wisdom. A man of wisdom can talk like this. I heard through one of my professor at AIMS Rishikesh, when I joined as a ENT department lecturer, somebody said जलनेती allergic sinusitis के लिए treatment है, I used to laugh at that person. Today I am treating my own director Ames. Now I am the head of the department. I say Jalneti is the treatment for allergic rhinitis. So a man of wisdom, a man of knowledge, there is a difference. जो पूरा ज्ञान परिपक्व होता है उसको हम बोलते हैं wisdom, man of wisdom. Our rishis were men and women of rishi, rishika. They were men and women of wisdom. So that's what exactly we saw in Dr. Sunil Saini ji, who comes with a lot of experience and that holistic approach. And when he said, when you treat a patient, you should have peace within. Then only we can bring in the peace in the person and his family. So that's what every doctor ought to do. That's what every health worker ought to do. That's what every member of a family ought to do. That's how we are going to give the best care for a patient who is suffering with cancer. Coming to the next holistic approach, to summarize as Ratanji has requested, yes, हम 3 बात बोलते हैं, right eating, right thinking, right living with right activity. So for that we have to understand what is wrong eating. वो खाना जो कैंसर को बढ़ाएगा, वो एक्टिविटी मतलब एक्टिविटी नहीं करने से आपको कैंसर होने का संभावना बढ़ेगा. और सबसे ऊपर है वो सोच जो आपको कैंसर डेवलप करने के लिए मजबूर करेगा. सो वी पुट इट एज दिनचर्या. अर्ली टू बेड, अर्ली टू राइज, eating right, doing right activity and thinking right. This is the basics of holistic approach to any disease, even to life. So again, he used the term lifestyle modification. In the present scenario, if the cancer disease is increasing, that's one is due to the availability of the test and the specialist that were diagnosing more number of patients, that's true. But at the same time, the modern way of living, the present way of living has to be modified, lifestyle modification. So keeping this in mind, everything remains the same. When I said Manu Chabriyaji has reversed his diabetes, similarly, if I can say I have removed the inflammation in my body, I have prevented cancer. If I have cancer, if I can do something to reduce the inflammatory things to my body, I can again treat the cancer, even to cure the cancer. Yes. As I said, the best of East and West, that's what Swami Vivekananda wanted. Western science coupled with Vedanta, Brahmacharya as guiding motto. 3 terms we have to understand here. The best of the West is going and seeing everything through the matter. टेस्ट करके एग्जैक्टली सेल ऐसा है, ये डायग्नोसिस है, इस ट्रीटमेंट के लिए, इस कैंसर का ट्रीटमेंट यही स्पेसिफिक है. सो वेर एवर देयर इज स्पेसिफिक ट्रीटमेंट, वी शुड गो फॉर द स्पेसिफिक ट्रीटमेंट विच इज रिसर्च बेस्ड. जहाँ पे स्पेसिफिक ट्रीटमेंट नहीं है, सो आफ्टर द कैंसर सर्जन एक्सपर्ट हैज सेड यस दिस व्हाट बेस्ट वी हैव डन, we can also add to it. So that's what exactly he is doing in his institution. He being the best oncosurgeon, he adds to it. So in simple thing he said, आपके घर में जो किचन में homemade मसाला है, that is the best anti-cancer medicine that we can have. Food as medicine. So already I have simplified in my last talk. अगर आप बहुत ज़्यादा नमक खा रहे हैं, गलत खा रहे हैं, बहुत ज़्यादा चीनी खा रहे हैं, गलत खा रहे हैं, बहुत ज़्यादा तेल मसाला और bakery items which are processed, milk and milk product and the non-vegetarian food. So he said in the West, the research have shown the non-vegetarian food has high risk in developing cancer. Similarly, milk and milk product also have. When it comes to diabetes, I say it authenticatively because my patients who came with uncontrolled diabetes, I just made this change and their diabetes came in a very good control. So based on that, I say, when I say no non-vegetarian, also we should say no milk and milk product. I don't know whether we have research papers on this. Milk and milk product increasing the risk of developing cancer. Yes, he agrees for that. So again, the principle is same. If you are eating a lot of salt, sugar, oil, processed food, milk and milk product and non-vegetarian, you are increasing the inflammation in your body, you are a high risk candidate to develop cancer. If you remove that through right eating, what is that? That food which contains fiber, that food which contains phytochemicals, that food which contains antioxidant, that food which contains immunity boosters, that food which contains anti-cancer agents. What is that? As I already said, the fruit. Fruit is a complete food. If you are taking fruit, you are getting the best anti-inflammatory drug. Then the raw vegetable salad. If you are taking a lot of salad, you have got the best inflammatory drug. And added to that, our homemade masalas. Adrak, haldi, lesun, garlic, then tulsi, pudina. All these have anti-cancerous properties, and this is proven on the research-based papers. So that's what I wanted to share, right eating. Then coming to activity. If you are getting obese, you are not doing any physical activity, you are going to increase the inflammation in your body, thereby you are increasing the risk of getting cancer. Reverse is be active, go in the nature. Just don't be inside four walls. Go in the nature. Then coming to the taking care of the mind, we are always worried. Yes, we should be free from worries because that itself is the highest inflammatory agent. So free from negative thoughts. For that, what we have to do? Fill the mind with divine thoughts, positive thoughts. Be in connection with the higher power. Swami Vivekananda. उनका वाणी पढ़ो जाके. Strength is life, weakness is death. जाके उपनिषद पढ़ो. I am आत्मा, मैं आत्मा हूँ, मैं शरीर नहीं हूँ, है ना? So these thoughts can be best medicine to remove the inflammation. So we say it as medication as the highest meditation as the highest medication. Food as medicine. And when it comes to meditation, yes, we should practice daily. Pranayama meditation is compulsory for everybody. Understanding the science, practicing with our own experience, we go on getting peace, joy, happiness. So peace, joy, happiness is the best medicine. So start with the physical medicines and reach to that higher level. Yoga as way of life in conclusion. So if you can make yoga as way of life, you can be free from cancer, you can fight with cancer, you can lead a happy life with cancer. Bhagavan Sri Ramakrishna, who was the Guru of Swami Vivekananda, 11 September 1893, we remember, World Parliament of Religion, जिन्होंने पूरा दुनिया को देश का नाम बताया और वेदांत का मैसेज दिया, उनको गुरु भगवान श्री रामकृष्ण. He had throat cancer. He never had a bit of pain because he used to attain that state of samadhi. जब हम उस समाधि अवस्था पहुंचते हैं, जब अपने आप को अपना रियल स्वरूप का बोध होता है, we will be free from all sorts of pain. योगो भवति दुःखः. अगर आप योगी बनोगे, सर्व दुख से आप मुक्त हो जाते हैं. सो भगवान श्री रामकृष्ण का जीवनी पढ़िए. वो देखिए जैसे भजनानंद में, ब्रह्मानंद में रहते थे, उनको थ्रोट कैंसर का पेन नहीं होता था. जब व्यवहारिक जगत में आते थे, अपने शिष्य लोगों को बोलते थे, ये देखो मेरे को बहुत दर्द हो रहा है, कुछ दवाई दे दो. सो एज लॉन्ग एज यूर इन द फिजिकल लेवल, शरीर है तो व्याधि है ही. सो अगर व्याधि से मुक्त होना है, शरीर के परे होना है. दैट्स वेयर मेडिटेशन इज द हाईएस्ट मेडिकेशन. व्हेन यू डू दैट, yes, it has a positive effect on your physical health also. There are some genetic studies which are done. People who did meditation, their genes changed. Their genes got changed. So these are all lot of research going on. So yoga as way of life can help us to prevent cancer, to fight against cancer, even to cure some cancers. We have to always remember the best of East and West. We have to have a best oncosurgeon, oncologist to help our patient or family member with cancer. At the same time, what we can add? Love, care, support. That is the best thing I can do. अरे वहाँ जाना है, वेट करना है, ऐसा माइंड करके जाएंगे. If he has to see 100 patients in his OPD, he has to have 100 hours. 100 man hours we call. So he has to have build a team. That's what we were discussing yesterday. So we all can be part of treatment for a cancer patient when we have this knowledge, holistic approach. So that's what we are trying to do. We'll have many more series like this to understand more about body, mind and soul. So we keep on learning. At least once in 2 months we should all meet here, the doctors, the nurses and our devotees and all the health lovers. So this is a just beginning stage we are into. So please visit our YouTube channel, Ramakrishna Mission Mumbai. We have a playlist by the name Everybody Know Your Body. In that this is recorded and you can share with your friends and family. So the important thing to take back home, what is the take back home message today? Be at peace. अगर आपके घर में किसी को कैंसर है, ऑलरेडी वो भय से है, ग्रसित है, क्या उस भय को और आप भय बढ़ाएंगे कि उसको कम करेंगे? अगर ऑलरेडी डार्कनेस है इस रूम में, कि आप थोड़ा दीप जला के वो डार्कनेस हटाएंगे कि फिर ऐसे डार्कनेस रहने देंगे? तो यू शुड बी एट पीस, यू शुड बी फ्री फ्रॉम दैट भय, फियर. So that way you can serve your patient. So with this message, let me conclude. I tried to close by 4 o'clock. Yes, we have done it successfully. Dr. Sunil Saini exactly did 250 to 350 he did. Last 10 minutes I wanted to just wind up. 4 o'clock we are on time. Though we started 10-15 minutes late, but we are closing on time. So we try to meet once in 2 months, getting such eminent personalities. Out of their busy schedule they come here and make the subject so simple. The complex subject is made so simple and it's practical, understandable. So we are very grateful to Dr. Sunil Saini ji for his valuable time, lecture based on his wisdom, and we are very much benefited. So with this note, shall we close here? Om Shanti 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 Hari Om Tat Sat Shri Ramakrishna Arpanamastu. जय श्री गुरु महाराज जी की जय, जय महामाई की जय, जय स्वामी जी महाराज जी की जय, जय श्री श्री दुर्गा माई की जय. So we have replaced tea with काढ़ा. Tea is inflammatory, coffee is inflammatory. अगर रोज आप चाय कॉफी पीते हैं, आप कैंसर होने का संभावना अपने अंदर बढ़ा रहे हैं. अगर उस चाय और कॉफ़ी को काढ़ा से अगर आप रिप्लेस करते हैं, यू आर गोइंग टू हैव द बेस्ट एंटी इन्फ्लेमेटरी मेडिसिन. दिस वी हैव ट्राइड विथ आवर ओन डॉक्टर्स हु केम विथ सीवियर बॉडी पेन. आई एम एवरीथिंग फाइन स्वामी जी, बट बॉडी पेन बहुत है. मैं डॉक्टर ना बहुत बिजी रहता हूँ. मैंने बोला दिन में कितने बार चाय पीते? 5-6 बार. तो कैन यू चेंज इट विथ काढ़ा? दे डिड, एंड आफ्टर 1 month what was the result? I am free from pain. So काढ़ा is the best anti-inflammatory drug. Kadha is anti-cancer, but at the same time you have to see if somebody is already diagnosed with some cancer, कुछ भस्म लेके काढ़ा लेके ठीक करेंगे वो भी गलत है. So east and west का combination को लेना है. So we tried a small thing. We have replaced chai with kadha. Enjoy that kadha. Okay, thank you.